Congressmember Judy Chu, and I just took an incredible tour of the Wesley Health Center of Pasadena. And I want to thank CEO Alice Ballesteros and his team for welcoming me and showing me what they do here. It is incredible, the depth and the breadth of the services that they provide, everything from dental care to psychiatry to general care to chiropractic services. I mean, they have it all, and it's all at an affordable price. The insured and the uninsured is turned away. This is the model of healthcare healthcare affordable for all. Louise McCarthy, President and CEO of Community Clinics Association of LA County, and the amazing team from Ultimed, Via Care, and Health Center are all part of this system. That thank all of them because they are a lifeline to our community. You know, community health centers are the backbone of our healthcare system. Every day they provide affordable, high-quality care close to home. They provide preventive services, chronic disease management, dental care, and so much more. And they do it regardless of a patient's income, immigration status, or insurance coverage. For millions of Americans, health centers like this are their only access to care. But as you know better than anyone, community health centers can only keep their doors open if funding is stable. Medicaid is the single largest source of funding for health centers nationwide, and the Affordable Care Act premium tax credits allow millions more patients to afford coverage, which strengthens health centers and lowers costs across the entire system. But Donald Trump and Republicans have just passed the largest cut to both these safety nets in our nation's history. It was just over 2 months ago that they passed the big, ugly bill, which rips $1.5 trillion out of our healthcare system. It kicks 15 million Americans off their insurance by gutting Medicaid and weakening access to the Affordable Care Act. And this is the largest cut of healthcare to Americans in our nation's history. And why? So that they could give those savings to billionaires and big corporations in the form of massive tax cuts. And you know, they don't need that money. And when millions of patients lose health coverage, the strain is immediate. We see worse health outcomes for people who delay care or go without it, and more financial pressure on health centers that still serve these patients but are forced to do so with far fewer resources. And now they want to make the damage even worse by refusing to extend the ACA premium tax credits that expire at the end of this year. Democrats fought to expand and strengthen these credits so more people could finally afford coverage. And it worked. This year, ACA signups reached a record 24 million enrollees, almost double the number when Trump was last in office. And in fact, we have the highest number of insured people in our nation right now. But if these credits disappear, 24 million Americans, including more than 2.5 million Californians, will see their premiums skyrocket, in some cases by 75%. Right now, these tax credits are the single most important tool we have to keep healthcare affordable for millions of Americans. Now, in this district, my congressional district, 61,000 people rely on these tax credits to afford their coverage. If Republicans let them expire, 140,000 Californians will lose their health insurance altogether. And for those who keep it, the cost will be staggering. A 60-year-old couple in our district making just over $80,000 would see their premiums soar by 283%. Nearly a quarter of their entire income would go just to health insurance. That is immoral, and it will crush working families who are already suffering from higher prices due to Trump's reckless tariffs. And here's the reality. We are now just days away from a government shutdown because Republicans refuse to extend these tax credits to millions of Americans. That's how extreme and reckless they have become. They bent the knee to Donald Trump to pass their big, ugly bill, and they pushed a partisan spending bill that failed in the Senate, and now Donald Trump canceled bipartisan negotiations altogether, refusing to meet with Democrats. Republicans, in fact, left town and made their priorities clear. They will do anything to cut taxes for billionaires, but they are ready to shut down our government if it means extending affordable health care. But Democrats are united. We are standing with patients, providers, and working families against Republicans' assault on our healthcare system. And that's why on Monday, my Democratic colleagues and I are going back to Washington, D.C. to fight for a spending package that extends these tax credits, keeps premiums affordable, reduces health cuts, and protects our entire healthcare system. We cannot let these tax credits expire. We cannot let millions of Americans suffer higher health costs due to Republicans' failed leadership. So thank you again to Wesley Health Center for opening your doors today and for the extraordinary care you provide every single day. And thank you to all the other community clinics who constantly work hard to serve our most vulnerable families and neighbors. Your work is what this fight is all about. And I will never stop fighting to protect health coverage, strengthen health centers, and stop this outrageous Republican attack on our health care. Thank you so much. And now I would like to introduce the CEO of Wesley Health Centers, Al Ballesteros.
Thank you. Can we just give a big round of applause for our Congresswoman Judy Chu? She's been fighting for us many, many years, and has always been there for people that need her. Appreciate that. I also appreciate all the staff of Wesley that are here, as well as all of our partners from the community, our board members that are here. I appreciate Joe and Lawrence, and I know you're going to hear from Christopher, and so thank you all for being here. So, Congresswoman, we're worried. We're worried because when premium support goes away for health insurance, populations and people are not able to pay those, and so what happens, they drop out of care, they do not come for their visits, they do not get their medications, they do not get the services that they need. Now that's really important because in this clinic, we take care of about 300 or so individuals living with HIV. And if you know about the disease, individuals have to come and get their appointments. They have to have their regular lab tests taken, and they have to take their medications in order for the virus to remain under control. It's important for the virus to remain under control because, as you'll hear later from one of our providers, not only does that improve a person's health and give them the opportunity to have a normal lifespan, but it also protects the community from the spread of HIV that will occur when individuals' viruses are not sustained. So I'm worried. I'm worried, Congresswoman, because I remember 30 years ago when individuals living with this disease did not have access. I remember 30 years ago when individuals living with this disease ended up in the emergency rooms and in the hospitals from a condition that at that particular time there were no treatments for. But today, individuals should not end up in the emergency room and in the hospital for a condition that is absolutely treatable, but the treatment then becomes out of reach because individuals cannot afford their premiums because the federal government is taking those away. So we're worried, we need something done about it, and we know that you and other colleagues of yours at the federal level will do everything they can to protect these services. So please support these efforts to make sure that our community does not lose access to health care. Thank you.
And now I would like to introduce the president and CEO of the Community Clinics of LA County, Louise McCarthy.
Thank you, Congressmember, and thank you for everything and the voice that you bring to our voice to DC. We really appreciate it. So we are the coalition of all the community health centers across LA County. Countywide, these health centers serve over 2 million patients every year. The majority of these folks live below the federal poverty level. These folks are getting comprehensive, quality care from over 450 sites countywide. That's Antelope Valley down to Long Beach, Venice, all the way into the San Gabriel Valley. Community health centers are rooted in their communities, and they are committed to providing quality care to everyone, regardless of ability to pay. But they can't do that without resources. And so the access that they provide is really contingent on some folks having coverage. And so right now at this time, the majority, roughly 3/4 of patients walking into a health center are on Medicaid. And another 100,000 patients are on Covered California and relying on those subsidies. So if they lose those subsidies for their Covered California coverage and become uninsured, the health centers are still going to continue to serve them, but they're going to scramble to find the resources to do that. They're going to scramble also because their patients that are on Medi-Cal will be facing barriers and barriers to staying enrolled. There will be work requirements, paperwork requirements. There will be more frequent need to resubmit their paper. All of these things are going to push people off of coverage. And the community health centers are going to continue to try to serve them. But without resources, without coverage to cover care, they're going to need to think about maybe reducing the amount of services they provide. We're going to see wait times for appointments get longer, so that folks are going to end up turning to the emergency room because they're waiting for care that now, in this current time, they can get an appointment. They can walk in for a same-day visit. These things are all going to be constrained as we see people lose coverage. So without coverage, we cannot provide true access to comprehensive quality care. So for that, we absolutely urge the folks in DC to come to the table and to have the conversations, the dialogue that needs to be made to get an agreement around healthcare, around coverage, around what is a right for all Americans and what is going to keep our communities healthy. Thank you.
You know, it's so important to hear from the people that these clinics serve. So now we have a very brave patient who's going to tell his own story. Christopher Ewing.
Thank you very much. I go by the name Christopher J. I was invited here just to give a short testimony about how Medicaid has helped me, and I plan to do that. But before I do that, I'd like to take a minute just to give a reminder that goes along with all the great information that we've gotten about what's at hand. But I'd like to just give a quick reminder that I believe that it's correct that most people that are on Medicaid have benefited from Medicaid, or who have worked. They have worked in their lives. At some point in their life, they've worked, or their families have worked, or their families have been involved in the military and fought wars for the freedom of this country. So I want to remind people that Medicaid may not be a constitutional right at this time, but we have all certainly paid into it with our state and federal taxes. That's what we have done. So not only do we want to keep our Medicare, I want to keep my Medicare, and I want to keep it now. And that's the message that I think that we should also remember as a reminder. that we're not begging for anything, because we've already paid into Medicaid. We've already paid our taxes and paid our debts and paid our dues and marched the marches and worked the work that we did, and a lot of us are retired and need this stuff. And that's something that we should remind. So when we come into these battles, we're not coming in with a hat in our hand saying that we want a handout. We are demanding what we are already paid for, what we've already put it into. So let's not forget that point. So lastly, I'd like to spend about another minute just to say about how Medicare has helped me. And just in short, I'd like to say that not too long ago, that I was bound in a wheelchair. And I was becoming very debilitated, and I was losing my ability to use my hands and my feet and to be able to walk, and other enjoyments in life. And over a 2-year period, I had to have serious surgery, spinal stenosis surgery, and it took a long time to heal. And just a long story short, because it's about Medicaid, that I wouldn't have been able to have that surgery without Medicaid. And that's why I'm here today, to be able to say and to stand up and to speak to what I'm saying today. And if it wasn't for Medicaid, I wouldn't be here right now. So for that, I owe a great debt to Medicaid and all the people that are associated with Medicaid, and the politicians and the healthcare clinics that utilize those services that did help me. So I just wanted to take my little time just to make that point, and pray that with everything that we've already heard, along with what we're going to hear right now, that it will add up together as something that will not only bring us together, but remember, it's not about one person, it's about us. It's about us. Thank you.
Well, thank you, Christopher. That's an amazing story, and look at how he's walking around now. Well, okay, now I'd like to bring up a provider of primary and HIV care at Wesley Health Center, Pasadena, Dr. Lauren Walchuk.
Thank you. Christopher, that was so powerful. Thank you for sharing. And good morning. My name is Dr. Lauren Walchuk, and I'm a physician here at Andrew Escajeda Clinic, a community health center and HIV clinic with Wesley Health Centers in Pasadena. I want to thank Congresswoman Judy Chu for standing with us today and for her tireless advocacy to protect Medicaid and the people who rely on it. At our clinic, more than 2/3 of our patients depend on Medicaid for their health care. These are not just numbers. They are working families, seniors on fixed incomes, people participating in rehabilitation programs to get back on their feet after transitioning out of incarceration, and people living with HIV who need consistent, compassionate, and comprehensive care. If the proposed Medicaid cuts are realized, the consequences for our clinic and our community will be substantial. I worry about cuts and restrictions on drug formularies, which will make it harder for patients to afford their needed medications, even more limited access to and extended wait times to see specialists, and of course, reduced Medicaid enrollment, particularly for our undocumented patients who only recently gained Medi-Cal access. I've been assured by our clinic management and our CEO, Al, that we won't have to face reductions in staffing, cut services, or turn people away who have nowhere else to go, but of course I remain concerned about these possibilities. I worry that the funding cuts will result in delayed diagnoses on managed chronic illnesses and more emergency room visits and more preventable deaths. For our HIV clinic, these cuts are especially dangerous. HIV is a manageable chronic health condition today, but only if people can access regular treatment and support. Without Medicaid, our patients may be forced to choose between paying rent and getting their medications. And this puts their health at risk and increases the chance of transmission, reversing decades of progress. As just one example, a 46-year-old woman diagnosed with advanced HIV, AIDS, and several serious opportunistic infections like PCP pneumonia and Mycobacterium avium complex several years ago as a result of delayed HIV screening, has been able to return to health and her work after achieving viral suppression and immune reconstitution, only possible because of stable Medicaid coverage. Let's be clear, this is not just a budget issue, it's a public health issue, and it's a moral issue. We are at risk of creating a system where only those with means survive and thrive while others are left behind. I urge our lawmakers to stand with clinics like ours and the patients we serve. We need investment in care, not cuts. Thank you again, Congresswoman Chu, for standing up for health equity and being a champion for our patients.
And I also want to acknowledge that we have representatives from Ultimed. Could you raise your hand? Oh, okay, thank you. And from ViaCare, yeah, and from Harold Christian Center. Thank you for being here. They are such valued clinics in our district. And so, questions from the press?
How concerning is it, that people have to now think about this, about whether they'll be able to get these procedures done?
This is an extremely serious situation. You know, healthcare is the most precious thing that you could have. Good health is at the center of everything for a person's life. And to think that you could be just ripped away from this is extremely serious. Now, remember that before the ACA, before the Affordable Care Act, there were people who could not get any insurance because of pre-existing conditions. You know, maybe they had asthma as a kid, and then they could not get any insurance whatsoever. And the ACA made it possible for them to get insurance, but it was still too high for a lot of people. And that's why we, the Democrats, during the COVID era, were able to enact the tax subsidies. And the amount of sign-ups skyrocketed. So without those subsidies, really and truly, there will be many people who will say, I can't afford it. They will go without it, and that would be very, very tragic. It would be tragic because there's so many diseases that can be prevented if you get early intervention, but it would be tragic because maybe it'll be too late and people will die. People will die because of this.
And for this health clinic, how will you guys handle patients who do rely on these services? Will they still be able to continue with their appointments, or I don't know if you've started those conversations?
Yeah.
Well, we are a federally qualified health center, so we will not turn anybody away if they don't have insurance or there's a lack of ability to pay. Now, what that will mean is that we would have to find funding elsewhere. And, other types of services that we provide may be curtailed. Some that are not deemed as critical. Because, I think that we could all agree that the most important thing for patients is getting their medical care and getting all their other medically related services. So we will have to work with our local county to free up resources to cover some of the other types of services through perhaps Ryan White or other county resources. But the problem is it's not going to be as efficient, as effective, and as streamlined for people living with HIV or people that are just receiving regular primary care for other types of conditions.
Okay, any other questions? If not, thank you all so very much.
Thank you.